You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today is an extreme makeover edition with minimally invasive techniques. You can look years younger. My advice, stick around for the latest edition of The Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering any type of minimally invasive facial rejuvenation. My first guest actually needs no introduction. She's San Diego's probably most well-known and hottest dermatologist, Dr. Tess Mauricio. Dr. Mauricio, welcome to the program.
Thank you, Randy.
And you live up to your introduction, by the way. You look 15 years at least younger than your age.
Thank you, Randy. Well, you know, whenever people tell me, because they watch me on TV, and then their first thing whenever they see me in consultation in the clinic is, my God, you look so much younger than even on TV. And I always tell them, thank you to technology. It really is. I'm a walking advertisement.
Well, you're one of the few people that could pull off a real tight shot. I mean, because it's almost like you have no pores on your face. I'm trying not to endorse you too much, by the way,
the thing is,
it's true.
I never wear this much makeup, truthfully. I mean, when patients see me in clinic, I do not wear any makeup. Maybe a little bit of eye makeup, a little bit of lipstick, and I invite patients to take a look and see, because that is what technology can achieve now. And I was not born with great skin. It's just
hard to believe.
Yes, it's hard for me to believe that we can achieve this kind of amazing skin now, and it's not just available for me because I own the machine, or celebrities in Hollywood. It's available for everyone.
You say that, you were telling me off camera, you say that just about every celebrity is doing this kind of stuff. You just don't.
You know, take a look at even Oprah before 10 years ago. She looks better now. There's so many celebrities out there that you're wondering, how come they're not aging?
Yeah.
I mean, it's not natural for us, for all of us, to not age. We're continuing to age, but the difference now is that we have technology to truly reverse aging. We no longer have to go under the knife. We no longer have to go and have invasive, painful surgery and risk looking unnatural. We can keep ourselves looking young, looking great, feeling great, and without downtime.
Are you convinced, by the way? You know, okay, so somebody starts in there, and when should somebody start, by the way, with some of these laser treatments?
You know, we have patients coming in their early 20s, and these are the kind of patients who are just now starting to think about taking care of their skin. And so it's really, or they may have had acne when they were teenagers and now are suffering from acne scars. Is
earlier treatment better? Because you say you could stop. That means because you're rebuilding collagen. Is that right?
Absolutely. Earlier is always better. We're all aging, and so every day with sun damage and just intrinsic aging, we're breaking down collagen.
Okay.
When we do procedures like the photofacial, the Refirm, and Fraxel, what we're doing is we are rebuilding collagen. And so we can stop aging, we can even reverse aging.
Now we're going to have to put, I should mention too, I mean, you did not pay to be on this program. It's a real interview. You're not running cue cards, but am I going to have to put disclaimers everywhere that say, because you're saying stop, yeah, but you're saying stop aging. I mean,
you can.
I mean, you feel that.
Absolutely.
The appearance of aging.
We have, well, yes.
Okay.
You know, this is a joke that I tell my patients, is that, you know, I may be losing my vision, I'm starting to get a little farsighted. The insides may be getting older, but the outside still looks pretty young.
Because, yeah, and I know your age, and I keep saying that you look a lot younger. Your husband too. You do treatments on each other.
Absolutely.
He's your
we take off maybe one day out of every month, and we do all of the treatments that we're going to talk about to each other. We're believers of this technology. We want to keep each other looking great. And it's possible now.
Let's talk about
your
credentials. I mean, people, I guess, physicians travel all over the country to see you. You speak nationally, is that right? And internationally.
Right, right.
On what? On what topics?
I speak about skin rejuvenation. I speak about body sculpting. And so, you know, and then teach physicians, it's really all about educating them how to do this right, because there's really a right way and a wrong way. And also, on top of that, there's an art to doing this right, so that patients get amazing results each time. And
how much is art and how much is science? I mean, you have to have an eye for it.
I would say 80% art. And then the rest is technology. Obviously, you have to have the right technology, specifically for if you're going to apply it on all skin types. Okay. But the rest of it is really how much do you know the skin, How much do you push the skin so that, you know, patients can get great results?
Do you have an advantage as a dermatologist?
Absolutely.
Because medical spas
that.
are everywhere now.
And that's true. We have the benefit, and my patients have the benefit of really, you know, having my expertise and our expertise in the clinic, that we know skin, we know how to treat it well, we know how to treat all skin types well, and we can guarantee them. I can look at them, you know, during consultation and say, I can guarantee you we can get great results.
Great results. Now, your husband works with you.
Yes.
And we should talk about your background and training. He went to Yale undergrad. You guys met at Stanford, is that right?
He's a smart guy, but he's the coolest, nicest guy you'll meet. And all my patients, all my patients really appreciate talking to him. He's a great listener. He's a great educator. He makes sure the patient's concerns are addressed.